for our Club Med virtual members. My name is Valerie and I am on the service chair for Club Med. I will be leading today's workshop session. I will be reading the comments in the chat and facilitating the conversation. Thank you everyone for joining today's workshop session, our first workshop of many to learn about CPR. Before we start, I would like to remind everyone to keep themselves on mute unless Professor Hamam asks members to participate. If you have questions or comments, feel free to post them in the chat and we will address them as we proceed through the session. Please maintain proper etiquette throughout the session. A Google survey will be posted in the chat at the end of the session for our Wayne State students. Be sure to complete it to earn your participation points. The survey will end 30 minutes after the session ends. Please make sure the survey works for you before leaving the session. Professor Hamam, you may begin.
Hello, everyone. Can you hear me? Is the voice okay?
Yes.
Very good. And can you see my PowerPoint?
Yes, we can see it.
Very good. Let me fix something quick. Okay. Can you still see it? Everything is good?
Yes, everything looks good.
Very good. Thank you. First of all, thank you for having me. It's an honor to be here with you tonight to share some important information that can save many lives. Special thanks to Club Med Virtual at Wayne State University for organizing this wonderful event.
Thank you for taking the time to do this. We really appreciate it.
You're very welcome. Thank you.
You must have a crazy schedule, so the fact that you fit us in your schedule, we greatly appreciate it.
Thank you. Thank you. I appreciate that. So today I'm going to cover sudden cardiac arrest, how to recognize it and respond. So at the end of the presentation, you should be able to know what the difference between heart attack and cardiac arrest. What are the symptoms? How can you differentiate between the two? And how can you intervene? I mean, how can you help patients with heart attack or cardiac arrest? What are the signs, the symptoms? What are the treatments? I'll show you some short videos. And at the end, if you have any question, feel free to ask me. I'm going to go ahead and get started. So approximately 7 million people around the world die from heart attack every year. 7 million people. That's a lot, right? Cardiovascular disease, which cause heart attacks and other problems like stroke, is the leading killer. So what is heart attack? Heart attack, also called myocardial infarction. This is the other name, MI, like Michigan, MI. Heart attack, also called myocardial infarction, it happens when a part of the muscle, of the heart muscle, does not get enough blood. The more time that passes without treatment to restore blood flow, the greater the damage to the heart muscle. Now, CAD, which is a coronary artery disease, they call it CAD, CAD, is the main cause of heart attacks. And there are less common causes, such as spasm, which is a stenosis or sudden contraction of the coronary arteries that can stop blood flow to the heart muscle. So what causes heart attack? Like all muscles, heart needs oxygen. And during heart attack, it can't get enough. Plaques or fatty deposits develop on the wall of arteries, and those are the vessels that supply oxygenated blood to the heart. If you see in this picture, you can see here plaque. So heart attack, it's kind of plumbing problem. The tubes or veins, arteries that helps the heart get blood will be blocked by fatty deposits or plaques They call them plaques. So when you eat like high food that's very high in cholesterol, that will cause damage of the walls of the vessels, and those can cause a blockage. So the plaques grow as we age. The plaques can turn into blockage, and if one plaque in here, one of the plaques ruptures or cracks, a blood clot will form around it in minutes. And partially closed artery like this one becomes completely blocked. And when it becomes a block, blood flow is cut off to the cardiac muscle, and the oxygen starved cells start to die within several minutes. And this is MI or heart attack. Now, things can deteriorate rapidly in the absence of treatment. The injured muscle may be able to pump blood that was able to pump blood to the heart muscles becomes unable to pump any blood, and therefore the rhythm might be thrown off, and worst case scenario heart attack can cause sudden death. So what are the symptoms of the heart attack? Most heart attacks involves discomfort in the center of the left side of the chest that lasts for more than a few minutes or just goes away and comes back. So the heart will have some pain, especially on the chest, and that pain might radiate to the left arm, neck, jaw, or back. But it's not always as sudden and dramatic as it's in the movies. So you may also break out into a cold sweat. You can feel some weakness. Patient can faint or have lightheaded, and this often comes along with chest discomfort. Shortness of breath also can happen before chest discomfort. So when you see somebody have shortness of breath and difficulty breathing, some chest pain, and they describe it as a crushing pain, that will be a kind of heart attack. So patient is conscious so far, not on the floor. So how do they diagnose heart attacks in the hospital or emergency room? In the emergency room, doctors can diagnose heart attack. They commonly use electrocardiogram to measure the heart electrical activity and the blood test to assess heart muscle damage. If you see here on my slide on the right side, you see normal AKG, and those they call them waves. Those are the P, Q, R, S, T. This is normal heartbeat. On the other side, it shows a clear of heart attack or myocardial infarction. When the ST is elevated, that means it's heart attack. So all healthcare professionals in the hospital, when they take BLS class or ACLS class, where they teach you how to interpret EKGs in details, you would be able to know how to diagnose myocardial infarction. When you see it in the monitor in the hospital, you would know right away, oh, this patient is having a heart attack. Let's get the crash cart and let's see what we can do right away. And there are many abnormalities where you can see in the EKGs, of course. So PQRST means it's sinus rhythm where the heart is pumping normal, like lub, dub, lub, dub all the time. When it starts to change, if it's up or down or faster or shorter, means there is an issue. And those will be covered in advanced ACLS class for all healthcare professionals. So we discussed the definition of heart attack, and we know what are the symptoms and the sign and how does it look like on the EKGs. Let's see what can they do treatment wise. There are four treatments. The first one is medication, balloon, second one, stent, or surgery. So medication, taking aspirin, which thins the blood, and nitroglycerin, which opens the artery, can help keep the heart attack from getting worse. So aspirin, they call it anticoagulant. Anticoagulant means a blood thinner, same as warfarin, coumadin, and other anticoagulant. So, but the medication that treats the blood clots called thrombolytic. And I'm sure most of you took medical terminology a long time ago. A thrombo is the blood clot, and lytics is how to break it up. So anticoagulant is to thin the blood. Thrombolytics is to break the clot. So definition will be anticoagulants are drugs that are used in preventing the undue formation of blood clots inside the circulatory system, whereas the thrombolytics are the drug used to for the removal of thrombi that occludes the vessel, causing various disease such as ischemic heart disease and stroke. So the major differences between the two is the anticoagulant are used to prevent blood formation or clot formation of new blood clots in the circulatory system, while thrombolytics are used to remove blood clots, which is the treatment. And some example of the thrombolytics are streptokinase and alteplase. That's why doctors advise or prescribe aspirin, very low dose of aspirin for anybody who's 80 or who is 50 years old and older, because it will help them prevent getting clots because it's a blood thinner. So balloons, stent, and surgery. Here, when the patient has a plaque, as you see on the screen here, this artery is partially closed. They put a stent that have a balloon at the end. As soon as they pass the blood clot, they inflate the balloon and they pull it back. So it will remove the blood clot. Sometimes they leave a stent inside it. This metal stuff here is just to keep the vein or artery opened so it doesn't shrink or block again. That's when they say we are leaving a stent in. Now, if patient needs surgery, of course, he or she will be taken to a high-tech cardiac suite where tests are done to locate the blockage. And they do it under X-ray, live X-ray, radiology. So X-ray technician or radiologist will be in the room and they will be taking continuous X-ray. That's why the surgical team will have the lead on and thyroid shield to protect the thyroid. And they will be taking hundreds of pictures just to locate the clot. And so how do they see blood clots if it's not radio opaque? Radio opaque means it shows under the X-ray, like the bones radio opaque, right? Because we can see broken bones, but we cannot see blood clots or um, maybe vessels under normal X-ray. And they're not gonna have MRI or CAT scan in each room. That will cost millions of dollars. So what they do is they inject the patient with dye, DYI, and those are X-ray detectable or radio opaque. When they inject that type of medication, the dye, they call it high opaque or vasopaque. So it will show on the picture or in the screen, the X-ray, where the blockage is, and the doctor can locate it and treat it right away. So what they can do is cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called angioplasty. Frequently, they also insert the metal polymer stent that will hold the artery open. Now, more extensive blockage when they cannot do it with the stent, that might require coronary artery bypass grafting. They call it cabbage, as you see in this picture. What they do exactly is they use a piece of vein or artery from another part of the body. Heart surgeon can reroute the blood vessels from another part of the body, and they do it around the blockage. And this procedure reestablishes circulation to the cardiac muscles, restoring heart function. In this picture, you see the blockage in here. They cannot break it with a thrombolytic. Aspirin, of course, doesn't do anything in this kind of condition because that's prevention that should have been taken a long time ago. They cannot insert stent because it's very hard to break or to pull out because patients have been smoking for years and having hookah every day for the past 12 years or eating a lot of cholesterol stuff, not doing exercise. So this blockage will be very hard in here to be removed by a balloon or by any stent. So patient needs surgical intervention. The doctor will take a vein or artery from different area of the body, maybe from the thigh, from the femur, wherever it is, and then they will bypass this block and they do anastomosis. Anastomosis is connecting two vessels together, and that will restore the circulation and reestablish circulation to the cardiac muscle, restoring heart function. Now, this is the heart attack. Let's go to sudden cardiac arrest, SCA. It's a condition in which the heart suddenly and unexpectedly stops beating. And if this happens, the blood stops flowing to the brain and other vital organs. And usually it causes death if not treated within minutes. That's why all healthcare professionals need to be BLS certified just to know exactly how do they interfere in a sudden cardiac arrest, how to do assessment properly, how to do compressions and CPR the right way. Because for heart attack, you cannot interfere a lot unless patient becomes having a cardiac arrest. So it can happen instantly at any time. So cardiac arrest can happen anytime. And as you saw that flat line at the end of the video, that's what you call in medical terminology asystole. A is without systole heartbeat, or some people call it a flat line or dead, no cardiac activities, too many names, but asystole is the proper name that they use in the hospital for all healthcare professionals. How to interfere, what you do if somebody have a cardiac arrest. There are three C's. Number one is check. Number two is call. Number three is compress. Those are the most common three C's that need to be done right away. How do you know if somebody have cardiac arrest? You will be doing assessment. Assessment having three main areas or three main things that you need to check. Number one is responsiveness. You tap on somebody's shoulder to know if they are awake or not, if they move their eyes, if they are nodding their head means there's no cardiac arrest. Could be different story, different stuff. Could be hypoglycemia, hypotension, drama queen, drama king. Who knows? We need to do proper assessment before we start the compression. So number one is checking responsiveness. Patient should be unresponsive. Nobody will have cardiac arrest if they are responsive. If they can open their eyes, if they can talk, it's not cardiac arrest, of course. The second thing you need to do is check pulse. You check carotid pulse, but by using your index finger and middle finger, you locate the trachea and you go half inch to the right or to the left, and you check the pulse at least 5 seconds and not more than 10 seconds. So they say at least you need to check the pulse 5 seconds. If you check it in 2 seconds, 3 seconds, means you did not feel anything. It takes 5 seconds at least to feel someone's pulse. And you should not be checking for more than 10 seconds because that's the maximum time patient can wait before CPR is needed. At the same time you are checking the pulse, you'll be checking breathing. Breathing is just looking on somebody's chest to see if it's rising up and down. So unresponsive, no pulse, no breathing, you need to call 911 and ask somebody to get an AED. AED stands for Automated External Defibrillator. This is the beautiful small machine to give electrical shock to the patient as fast as possible. And number three is you need to start compressing the heart right away. How fast somebody needs to compress the heart? It should be at least 100 to 120 per minute. 100 to 120 per minute is the right way to do it. Cardiac arrest, facts and fictions. The stereotype, people say, okay, it's only for male. The reality, male and female can have cardiac arrest. The age, people think it should be old only who gets cardiac arrest. Reality is any age. I've seen soccer players, I've seen many people have cardiac arrest and they're 18 and 20 years old. It depends. The risk factors, now they believe overweight, a smoker, and high cholesterol are the only reasons that can cause to that. But there is no known or 100% risk factors proven for that. Definitely, if somebody does not smoke, eat healthy, and stay in shape, will be less likely to get. But it doesn't mean every smoker and every overweight or high cholesterol candidate means they're going to have a cardiac arrest. Because I've seen many soccer players or many football players getting cardiac arrest, and definitely they don't smoke and they are in shape because they do exercise at least 4 to 5 days a week. So it's not 100% true. Medical history, heart attack. Now, heart attack, because there's a blockage in the artery, it can lead to cardiac arrest, but not all the time. Some people get cardiac arrest even though they don't have any past medical or surgical history. They are so healthy, and all the time, all of a sudden, they get cardiac arrest. Presenting symptoms, chest pain, dizziness, and the reality is sometimes there is no symptoms. Someone will be having no symptoms, and all of a sudden they get cardiac arrest. Now, what CAB means? This used to be ABC before. ABC means people are taking care of the airways first, giving breath, and then taking care of this compression or circulation. American Heart Association now changed it to CAB, CAB. The two main reasons for that are, the first one is to do compression as fast as possible because the brain can live maximum 3 minutes without oxygen. So we need to compress the heart as fast as possible to send oxygen to the brain and keep it alive from damaging. The second reason that people are dying on the street and nobody is doing, of course, mouth to mouth or giving breath because of many infectious disease or contagious diseases they might have, like TB, COVID-19. They might have other bacteria or fungus or whatever. So people are not doing CPR on the street because they are not comfortable and you don't have the right equipment. You don't have your bag mask, you don't have your face shield or pocket mask. So by using the CAB technique from American Heart Association, you are able to do compressions only. You don't have to give breath. Keep doing compression for 6 to 7 minutes till the ambulance arrive and the team take the patient to advanced care. Now, compression is the act of pushing on the chest. People often don't push hard enough because they are afraid of hurting the victim. For adults and children, you need to push 2 inches depth. If you don't push 2 inches, means you're not rescuing anybody's life. And injury is unlikely, but it's better than death. So don't be afraid or scared to break some ribs or bones. That's completely fine. The heart stopped working. We need to pump it. We need to keep the patient alive. And it's better to push too hard than not hard enough. So between 2 inches or 2.5 inches and 1 inch, Definitely 2.5 is better than one because one will not do anything, will not pump the blood out of the heart, will not rescue the patient. So 2 inches for adults, 2 inches depth for children, and 1.5 for infants who are less than 1 year. Infants are 0 to 1 year old. And for adults and children, you use both hands to do compressions. For babies, you use only 2 fingers for one rescuers, and for two rescuers, you use the 2 hands or 2 thumbs in circulating hand technique. Now the new update from American Heart Association for 2020, every 2 years they come up with something new. They said you can use your 2 thumbs in circulating hand technique even if you are by yourself. So for one rescuer or two rescuers, for babies, you can use your 2 thumbs or the heel of one hand. So you have to make sure the patient is lying on a flat surface. Move the clothes out of the way. If you have scissors, you can cut them. We don't care about the brand and how expensive the clothes at that time. We cut them right away in the emergency room or in the hospital. You put the heel of one hand on the lower half of the breastbone and put the heel of the other hand on top of the first one, and you push 2 inches depth straight, 100 compression per minute at least. And between the two compression or between each one, of course, you have to allow the chest to recoil. Recoiling means allow the chest to go back up to its normal position so that the heart can be refilled with blood again. So when you push on the chest or on the heart, you are pumping the blood outside of the heart to the vital organs. And when you allow the chest to recoil, the blood comes back to the heart and be ready for the third compression. So always allow the chest to recoil, and that's very important. And most people, when they do CPR, they put their hand a little bit lower than normal. Just remember that there is a diaphragm that separates the chest cavity from abdominal cavity. So when you do CPR on somebody, you have to put both hands between the two nipples on the chest cavity. Because if you go a little bit lower, you'll be pushing on the stomach, and that will cause all the gastric juice to come up and cause aspiration. And you don't want to do that. Also, most people think that the heart on the left side. So they put both hands on the left side of the chest. The reality is the heart is in the middle of the chest, a little bit tilted to the left side. So you have to push in the middle. Now, why isn't rescue breathing necessary? Why they changed it from ABC to CAB, CAB? Because during primary cardiac arrest, the lungs are full of air already, and the blood is full of oxygen. The blood did not lose any oxygen yet. And circulating the oxygenated blood is the key. The main idea at this time, or the main thing we need to focus on, is getting the blood to the brain because the heart is not pumping as normal. In this graph, or two pictures under each other, will show you how the blood supplies to the brain. If you do continuous chest compression, it stays up all the time. The blood will be flowing to the brain continuously without any interruption. The second picture, which is B, is compression and breathing together. Every time you're doing compression, the blood goes to the brain. You stop for two breathing, the blood stops from going to the brain. There will be like interruption in here. That's why they say you should not pause a lot for breathing. If you have to give breath, you do less than 10 seconds interruption or rules. So you have to give two breaths in less than 10 seconds. Should be quick. Go to the mouth, give two breaths quick using pocket mask, embo bag, or face shield. And then you go back to start compression right away. Now, breathing, compression are the most important part of CPR. If you have to pick between doing just compression or give only breath, definitely you have to pick compression. Compression is the main maneuver that enhance the survival of patients who have cardiac arrest. If you are also able to give breath, you will help even more if you can do it right in less than 10 seconds and quick. That's why two rescuers CPR is definitely better than one rescuer. And your breath need to make the chest rise. If the chest does not inflate or rise when you give breath, means you are not giving it properly. So chest should rise up and down. And when the chest rises, you know the person has taken enough air. So do you think compression alone can help somebody come back to life? Let's see. Oh, this in this slide, they teach you how to open the airways when you give breath. The most important part of this is to put your two fingers under the jaw to lift it up. They call this maneuver head tilt, chin lift. Head tilt, chin lift. Every time you have to give breath to children or adults, you have to pinch the nose and give breath through this mouth. If you have face shield that protect you from corona and other stuff, if you have a pocket mask, you can do that too. If you have embo bag or bag mask, even better. That's what healthcare professionals, especially anesthesia team, use it in the hospital or in surgery all the time. If you're not comfortable, completely fine. Don't give breath, just do compression. For family member, of course, you will do mouth to mouth. It's fine because you want to rescue them. But if you don't trust or there's any issue, you don't have to do it. And as I said, you pinch the nose for adults and children. But for little babies, because the area or the distance between the nose and mouth is very small, you don't have to pinch the nose for babies. You put your mouth on top of their nose and mouth together and you breathe at the same time. So what is an AED? When do you use it? What does it do? And let me teach you all the stuff about the AED. AED is automated external defibrillator that shock the patient to bring it back to the normal rhythm. You will use two pads, always need two pads, and the heart should be in the middle. Usually you put one on the right upper part of the chest, the second pad will be on the left side of the belly, and the heart will be in the middle because the main purpose of the pads is one to deliver shock and the second one to absorb it. If you use only one, it might not work or the electrical shock stays inside the patient's body. Now, all schools, churches, mosques, hospitals, surgical centers, dental clinic, everyone is required by OSHA to have AED on site because you can save someone's life by having AED. Let's see, is it easy to use? What does it do exactly? Let me show you short videos. And that video is very short, but you can see how the heart is pumping normal. And all of a sudden, the heart will start to shiver. When it's shivering, they call it ventricular fibrillation. That means the patient needs AED. And when they shock him, it goes back to normal. Just pay attention to the electrical activity of the heart. They putting the pad on and they shock them. It goes back to normal. One more time. The heart is pumping normal, lub, dub. All of a sudden start ventricular fibrillation, it's shivering, and then they put the pad on, they shock the patient, and it goes back to normal cardiac activity, which is sinus rhythm right away. So for the AED, there are three things you need to take care of. Number one is you follow the instruction of the AED. You turn it on first and you listen to the steps. It tells you what to do exactly, like step by step. It will say, put the pad on, plug the cord to the machine, analyzing, please keep distance. You have to make sure you are 1 foot away, and the machine might say shock is required. When it says shock is required, your responsibility to say, I'm clear, everybody is clear before you shock the patient. Otherwise, if the patient is laying on a metal table, uh, and you are close to it, you might get some thigh burns, or whoever is putting the hand on the table can get shocked too. That's why you have to say, everybody is clear, I'm clear. So you have to take the lead before you shock the patient. And when you shock the patient, you leave it on and you continue chest compression, because every 2 minutes the AED will shock, or sorry, it will reanalyze to tell you if patient needs shock or don't need shock. So to save lives, those are the three main things. You have to call 911 as fast as possible, because if you forget to call 911, nobody will be coming to help you, and you will be doing compression till you need compression, God forbid. That's why you need to call 911 before you start, because compression is very hard. You will be sweating. And because compression is very hard, if you have somebody with you who knows how to do compression, you need to switch with them every 2 minutes or 5 cycles. So switching will be every 2 minutes or 5 cycles. So after you call, you push, and then you use the AED as fast as possible. And if you are doing compression and somebody gave you the AED, you don't have to finish 1 cycle of compression. You have to stop and turn on the AED, put the pad on the chest, and follow the instruction. So AED need to be used as fast as possible. Also, if patient have hairy chest, you need to shave or clip before you put the pad on for the AED. And for wet patient, everybody is scared to shock someone who's wet, because they say electricity and water is very hard to do. But the reality is you can. You are able to shock someone who's wet. The only main concern is we have to dry where we put the pad up and down, but the patient's head or feet should not be completely dry unless they are submerged in water. Of course, you will be pulling them out of the water and shock them. But you can do that. Now in surgery, and I've seen that also in person in one of the surgery I was assisting, doctor was doing cabbage surgery, and the heart stopped working in the middle of the surgery. So then we didn't have to close the chest and pump or do compression on the chest 2 inches depth. What we had to do is just do cardiac massage. And I had the chance to do that. That was the best experience in my life. Now, what stops people from doing CPR? The main thing is the fear from mouth to mouth. The solution is do chest compression only. Another thing that prevents people from doing CPR is harming the person. Think about it. Worst case scenario, better than dead. You are not harming. Whatever you do is better than not doing anything, right? Legal consequences. We have Samaritan law that really protects civilians who help people they believe to be injured or otherwise in danger. And also, people think that they are not doing it properly, so they are scared to even initiate it or start doing CPR. And it's easy to do when you take the course or somebody teach you how to do it. Or some people think that they are physically unable to do that, but you have to do your best and call for help. So the last few slides here, the heart attack versus cardiac arrest. Heart attack is a blockage in an artery. Cardiac arrest, the heart stopped working completely. During heart attack, patient is usually conscious, they are awake. In cardiac arrest, the patient is unconscious, not awake at all, and even unresponsive. For heart attack, upper body discomfort or pain, and for cardiac arrest, often no symptoms, and person might be gasping or not breathing at all. And by the way, gasping is improper breathing. So it's abnormal breathing. If someone is unresponsive and gasping, we do CPR because it's cardiac arrest. Because people get confused between gasping, they think it's patient is breathing and doesn't need CPR. But no, gasping needs CPR for sure. So often a cardiac arrest occurs due to a heart attack. So from the explanation, you know now that heart attack can cause cardiac arrest because the blockage of the artery is partial. It might become complete and patient have cardiac arrest. But cardiac arrest does not lead to heart attack because heart attack is like, it comes, of course, before the cardiac arrest. And if you think about it, the heart attack is a plumbing problem, but cardiac arrest is electrical problem. The electrical activity of the heart is not good. The heart stopped working, and that's why we use the AED to shock the patient and get it back to the normal rhythm, which is the PQRST. And the sooner we do it, the better for the patient. Now, is CPR only for a human being? Of course not. As long as you know where the heart is, you can do CPR to anyone, all animals. You can do it to your cats, you can do it to your dog, or you can teach your dog to do it for you, like this picture here. CPR can be done for the squirrel, can be done for fish. Look at that, he put the straw inside the fish mouth to give breathing. This is funny to me. Why did you even take it out of the water? Trying to rescue her. So at the end, I want to say cardiac arrests are devastating and heart attack treatments is advancing, but prevention is vital. Prevention better than cure. Eat healthy, exercise, pray, avoid tobacco use and alcohol, enjoy plenty of sleep and lots of laughter, all go a long way in making sure your body's most beautiful organ keeps on beating. And thank you all. That's it for today. I'm open for any questions, guys. I'm here to help you.
If anyone has any questions, please feel free to unmute yourself and ask them, or you can just post them in the chat. I did post in the chat how to receive a certification. Professor Hamam, if you want to go through and talk about that. I know some people were confused on where to go on the website to request one.
Yeah, absolutely. And yeah, tonight should be ready in like 2 hours. We should be updating everything. So you can go to the website, which is www.lb-edu.com. Let me stop sharing here so I can add it at least to your chat here. Or you can call the number. You can call or text. You can write this number down: 313-549 and 2121. 313-549-2121. Am I still sharing screen or I think I'm
Yes,
still
you
sharing
are.
screen? Yeah, let me stop that.
Okay, so we actually have a few questions.
Yes, please
Someone
do.
asked, how long does it take for the heart to go from heart attack to cardiac arrest?
This is a great question, but it depends. It doesn't go all the time. Heart attack, if there's a quick medical intervention, if patient got aspirin right away, or they go to the hospital emergency room, patient can survive, and it doesn't go into cardiac arrest. Now, if there is no medical intervention and somebody at home alone, it might take few minutes. That's why it's kind of emergency for somebody to get when they get heart attack to go to the hospitals right away to just to seek medical intervention. So there is no exact time for that, But if patient gets aspirin right away and they have somebody next to them to call 911 to take them to the hospital, they will be good. Otherwise, within a few minutes, it might lead to cardiac arrest and depends on the blockage too. So there's many factors for that.
Someone else asked, how long does it usually take to recover from a heart attack?
And it depends on the severity of the blockage, the plaque, and the medication too. So if the blockage is very minimal and they take medication, they go to the hospital, within 1 week they should be good because they give the thrombolytic and they give the treatment. But if it's severe for somebody who have cholesterol, past medical history like diabetes and and other heart disease, it might be hard, especially if they need surgical intervention. For stents and balloons, they stay in the hospital for a few days. For CABG or big surgery, when they reroute the vessels, it might take up to 2 3 weeks to stay in the hospital, and then they take few months to recover completely and start doing exercise or live normal life again.
So I guess this question ties into that. Someone asked, why is cardiac rehabilitation important?
Yeah, you're right. Same thing.
Someone else asked, is chest pain normal after a heart attack?
No, no. Chest pain is always a critical symptoms. We don't, unless somebody have viral infection and they're getting a little bit of chest pain from coughing, that's a different story. But if there is no viral infection, there is no upper respiratory infection or symptoms, any chest pain should be taken seriously before heart attack or after heart attack. Patient need to go to the emergency room, call their doctors, take aspirin for prevention, and seek medical attention right away because it can lead to heart attack anytime. So it should be taken seriously. Any chest pain is critical.
Someone said, is there anything we could do to protect a patient having a heart attack before they get to cardiac arrest?
Absolutely. If you have aspirin at home, you know, aspirin doesn't need, I think, prescription. It's over-the-counter medication. And this is one of the best way to crack 1 or 2 tablets and put it under sublingual, or let the patient take it if they're awake. You don't want to cause any aspiration. And again, just to make it clear that I am a university professor, but I am not a doctor to prescribe medication or to recommend any type of medication. But this is what the research and the study says based on the academic research. They said taking aspirin as early as possible will help anticoagulation to prevent heart attack from causing more damage. So yes, taking aspirin is the key, and calling 911 to take him to the hospital is the key too. Good question.
Someone
But
said, oh, sorry, go ahead.
yeah, but no CPR needed for heart attack because patient's still awake. So don't try to do CPR because that might cause more damage to the muscles. So if somebody is awake, aspirin, talk to the doctor, call 911, and just keep an eye on him. You have to keep checking the pulse, respiration, just in case, God forbid, it change or it leads to cardiac arrest. So you know how to start CPR immediately.
Someone said, can a person with a heart stent be affected by AED shock?
You know, to use the AED means patient is having ventricular fibrillation or ventricular tachycardia. There are other conditions that can require electrical shock, but the most common one is the ventricular fibrillation. When patient need AED means they are close to death or they are either almost dead or might be, it's critical. So no damage, no more damage can be more than not giving AED or not using the AED. So AED should be used, but if somebody has pacemaker, let's say, you should not put the pad on top of a metal object because it can burn everything internally. But definitely, if the AED says shock is required, you can go ahead and shock because that's how you can save someone's life. So it should not be a big deal.
Someone else asked, if you come across an unconscious patient due to a cardiac emergency and you don't know how long they have been this way, would the way we help them be different?
Absolutely. You start CPR as if you just witnessed it because you don't know when they collapsed or when they had the cardiac arrest. So you do the assessment first to make sure they are not in deep sleep. You do the assessment first. If the patient is unresponsive, no pulse, no breathing, you start CPR immediately because the sooner you start CPR, the higher chance they have for survival. And somebody will be calling 911 and they will be taken to the hospital, and the doctor can either declare death, God forbid, or they can give some atropine, adrenaline, all those beautiful medication that can help them. But yes, CPR need to be done regardless of um, if you witness the cardiac arrest or not. Smart questions today. I love the questions.
Does anyone else have any other questions? Please feel free to unmute yourself.
Yes, please do that. At the same time, I'm going to write the website and the number they can call to get the certificate of attendance. This might help. Just keep it in your resume, or when you have a medical school application in the future, every little piece of paper will help because sometimes if two candidates have the same GPA, they did great with everything, they have 500 patient contact hours, but one have certification, one don't have the certification, definitely they're gonna pick whoever have more stuff in their folders. So I recommend that either call the number or text. I'm gonna write it down, 313-549-2121, or or you can order from the website starting from tomorrow, lb-edu.com.
Someone asked what they should write on their resume for attending this session.
You can I can send you an email and you can, if you want to share with them, or you want me to write it down here, however you want to do it. I can share it with everybody right now. It's
Yeah,
exactly what's yeah, it's exactly what's written on the flyer, and it will be cardiac arrest versus heart attack.
so we have another question. Someone said, what can happen to people who do not receive rapid treatment? Can this cause brain damage?
Absolutely. The main reason is do if the main reason of doing compression as fast as possible is to send the blood and oxygenated blood to the brain, because the brain can live maximum 3 minutes without oxygen. When someone does not receive chest compression as fast as possible, that can cause a brain damage, either partial or permanent. And And if patient does well in the hospital, they will have either paraplegia, they will have some other, definitely some other problems. So it can cause brain damage, and that can lead to other things. Yeah,
So back to what you were talking about with the pacemaker, someone asked, can you still place the AED pads on the same location or would it disrupt the heart rhythm even more?
the pad of the AED need to be placed not on the pacemaker. We can switch sides. So if you put one on the upper right chest, one on the left side of the belly, and let's say the pacemaker is under my hand here. So you just switch sides. You put this up here and the other pad down there. So as long as the heart in the middle It's fine, just for the electrical shock. For the pets, one to deliver shock, one to absorb it. That's why for babies under 1 year old, they put one pad on the chest and one on the back because the heart's still in the middle. Yes, you don't want to place the AED pad directly on top of the pacemaker because that can lead to maybe burning under the skin, and it's not good. That's a good question.
Someone else asked, could we accidentally kill the patient if we do the CPR incorrectly? However, doing the CPR is better than not doing anything at all, correct?
Absolutely. Doing the CPR as fast as possible, better than not doing anything. You cannot kill the patient because the patient is dead. That's why you're doing CPR, right? Because there's unresponsive, no breathing, and no pulse. So I would say 90% of people need CPR who already dead, right? So you cannot be afraid of hurting the patient more than what they have already. So definitely do CPR and nothing wrong with that. Do it as deep as possible, 2 inches depth, strong. You are pumping the heart and you are saving someone's life. I will absolutely do it anytime, anywhere. And I've done it many times and we broke some ribs before, and that's completely fine. We need to pump the heart, send oxygen to the brain. If the patient wake up with the broken ribs, that's completely fine. They can heal in the future and they will be so appreciated they are alive. So being alive with the broken ribs better than being dead with beautiful ribs, right?
Yes. Does anyone else have any questions? Okay. I don't.
So one more thing I want to mention. Definitely I want to thank you everybody again for this beautiful opportunity to be with you today. If anybody needs BLS, basic life support, or any certification, because that's needed for all healthcare professionals, just put, when you text the number above, just put the code 100. Just write code 100 because you get the special things. I'm not going to say what is it now, but just remember code 100. So we know that they attended this presentation with the Club Med Virtual, and we will be taking care of them. Thank you again for all these opportunities, and good luck with whatever you do, guys, in the future. I'm proud of all of you, future doctors.
Thank you so much for the insightful and informative session, Professor Hamam. We greatly appreciate your time. I know that I learned a lot from this session personally. I'm sure as did our members. To all of our Wayne State members, please make sure you complete the survey posted in the Zoom chat. Thank you for attending, and all of you enjoy the rest of your night. As Professor Hamam stated, for a certificate, go ahead and text that number and use the code 100, or if you want to use the website, I think you said that it'll be posted tomorrow, correct? We can
Absolutely. It's better if they text the number, just put your name and put code 100, and then we know what you need. Then we can direct you. We can send you a link directly to go how to order your certification, and we can send it digital for you. And we can send you also the information on what to write on your resume, because we're going to prepare all the stuff that need to be added professionally to the resume that will impact your medical school application in the future. And thank you everybody again. And please let me know if you need any help in the future with anything we can help you with. I appreciate the opportunity one more time, and have a great night.
have a great night. Thank you.
You too. Thank you very much. Bye-bye.
Bye.
Bye.